This is a 65 years old male with tongue squamous cell carcinoma. Patient underwent right hemiglossectomy and coverage with an anterolateral thigh flap. Patient post-operatively developed cervical abscess with a gas gangrene, which was detected by CT scan. Emergency debridement was done for this patient and removal of the ALT as well as the necrotic tissue. The patient came back positive for the abscess and post-collection with positive Staphylococcus hemolyticus as well as Escherichia coli. The patient then underwent further debridement and reconstructive surgery. So the problem list for this patient, he's a 65 years old male with a squamous cell carcinoma of the tongue. Patient is post-hemiglossectomy and reconstruction of the ALT. Gas gangrene and the abscess collection showed Staphylococcus hemolyticus with Escherichia coli. How would you face the case? Option A, deltopectoral flap and pectoralis major myocutaneous flap coverage. Option B, radial forearm free flap. The correct answer is option A.
So the correct management in this case report is deltopectoral flap and pectoralis major myocutaneous flap. This is option A. The authors correctly identified severe infection from a complex head and neck reconstruction with an ALT flap. Correctly, they performed emergency debridement and saved this patient's life, as any delay in management could have resulted in carotid blowout and patient mortality. They correctly managed this with a pectoralis major flap raised in a defensive approach with the second flap, the deltopectoral flap. 5 years on, testament to these authors, the patient is thriving. The authors have demonstrated an elegant salvage solution for complex, life-threatening complication after head and neck reconstruction. They highlight the importance of performing preoperative cleaning of the oral cavity and intraoperative wound cleaning, and then keeping a close eye out for signs of infection in the postoperative management. So thank you again. For more detailed and pioneering case reports like this, I encourage you to visit PRS Global Open, and goodbye from London.